type of dentistry that I perform and have been trained to perform over the years is called equilibration dentistry. There are two schools of thought on, on dentistry. We have hand floating, which is the act of addressing sharp points in the horse's mouth with 3-inch blades on handles. And it does help the horse. Every horse will have a different mouth. Some horses will have more problems, obviously, than others, much like people might have overbites, underbites, and things of that nature. So the type of dentistry that I perform is called equilibration dentistry. Equilibration dentistry doesn't only involve floating, but it addresses the chewing surfaces of all the teeth. So what we're looking for in equilibration dentistry, and every mouth is going to be different, but our final result, we want all of the cheek teeth and all of the incisors to be of a consistent height. And this will allow for optimum performance, not only with grinding and eating, but also from a performance standpoint, so that we don't have inhibitions on jaw alignment, movement front to back, and side to side. With the malocclusions that I'll find, I might find very simplistic things that need addressed, but I might find very advanced malocclusions that need addressed. But the end result is always the same. The goal of the end result is the same, getting to the equilibration. An older horse, on average, that hasn't had equilibration dentistry will have more malocclusions than younger horses. That doesn't mean that a younger horse can't have a horrific mouth. They certainly can. But on the law of averages, we'll say if your horse is 10 to 15 years old and has never had equilibration dentistry, the malocclusions are most likely going to be greater in that mouth than they would be in a 5 or a 6-year-old. Today we're here at Pine Knoll Farm in Lexington, Kentucky, and we are, the veterinarian and myself are looking at several horses, and one horse in particular that we're going to look at is named Brown. He's a 6-year-old thoroughbred gelding with a few malocclusions that could be inhibiting the performance. The veterinarian wanted me to address the issues that we found in the mouth, so that's what we're going to take a look at today. Once the doctor has sedated the horse, we go in and flush the mouth out, make sure there's good visibility inside the mouth. So after flushing the mouth, we want to get a good examination. So it's best, I feel, I can get a good examination of the incisors, the front teeth, when the horse is sedated and the head down. And the first thing I'm going to look at is the plane in which the incisors meet. If I were to stick a credit card between the incisors, that plane, typically we want to dissect the TM joint. In this case, we can see here on Brown where that plane comes right in front of the eye. Now the reason for this is we want good rostrocaudal movement of the mandible, front to back movement of the mandible from a performance standpoint. So when I'm looking at incisors, that's one of the first things I want to address. Now once we put Brown's head on the headstand, we'll look at we'll take a peek at the cheek teeth to determine what exactly the direction to go with the incisors. So the first thing I do is make sure his eyes are level. I want to see the alignment of the incisors, and I can tell right now his midline is off to the right, maybe a couple of millimeters. If we look at the midline right here and the corresponding maxillary midline, we see we're offset to the horse's right by a millimeter or two. Now, significance of this comes more from a performance standpoint, and the alignment of the jaw we typically want centered. From a riding standpoint, the reason for that is the neurologic function of the trigeminal nerve, which runs through the TM joint. So the whole goal here is that we have proper rostrocaudal movement of the mandible and also good side-to-side movement of the jaw without an inhibition of a movement from left to right, because as the horse bends right or bends left, the mandible has to shift that direction. So I can tell right now that our breakover point when I slide the mandible over is not a very great distance. This lets me know that his cheek teeth are in pretty close proximity. So I'm not going to get real aggressive on these incisors, but I do want to change the angle, the occlusal angle at which they meet. And that's not going to reduce the incisors or change his occlusion. Okay, so when I'm working on the incisors of a horse, it's really important that I keep the eyes level when we're talking about the best possible procedure to do on the incisor alignment. If the horse is tilted over like this and I'm down here working, I could potentially create a misalignment. So the important thing for me is to ensure that the eyes are level and work from that standpoint. All right, so I have a diamond wheel which will help me create the plane, work on the occlusal surface. Now initially what I'll do is just gap the incisors open with my hand at the diastema or the bars of the mouth. And the disc, I want dissecting that TM joint. So the surface of the disc should be aimed back to the TM joint. It has a very slight diagonal. This tooth was a little long. I reduced it lightly. So I'll come over here to the left side. So the next thing I will go to is a different instrument, a rotating burr, which is coated in diamond, and just finish the alignment on brown here. So I can, with the burr, I can get back on the back side of the occlusal surface. All right, now we can see here what I did was reduce the corner mandibular incisor. Really didn't touch the maxillary one. These teeth, he's young, these teeth are actively erupting. What's going to happen is these two teeth will join and be in occlusion probably within 4 to 8 weeks at his part of life he's in right now. These are new. These come in, the corner incisors come in at 5 years of age. 4.5 years of age, usually in full wear by 5. So I reduced the corner, and we want to ensure that we keep his incisor bite as level as possible. Obviously, there are going to be variations depending on the anatomy of the horse. Here are what I have is a diagram of Brown's mouth, and we'll typically chart each mouth so we have a good record of what's going on. This will help us track the progression of the rehabilitation on this mouth. And so the problems that Brown had, first of all with the incisors, are what we call a ventral curvature, where the red areas are diagramming the overlong portions of tooth. So what we wanted to do here was align this so that we get the incisors as close to level as possible. The importance of that is so that when he grinds on one side, these incisors meet in a level manner at the end of the grind. They chew in a circular motion, drop the jaw down, start to grind up, and once the cheek teeth are finishing their grind, the incisors connect and slide across each other. If we have high spots in a couple of areas on incisors, you can imagine when this jaw is over here and the overlong tooth here hits this overlong tooth, it keeps the cheek teeth separated longer. So we're talking about an efficiency standpoint. We want these incisors level and so that they can chew to an optimal performance. What we want is all these cheek teeth to be consistent in height. And when we have overworn areas and overlong areas, the bite fits together more in a puzzle fashion, which will dictate every time how the mouth occludes. If the teeth are level, we can get that mouth to occlude in a rostral or caudal position for even wear on the grinding teeth or cheek teeth. So that's the importance there. we want to rehabilitate this mouth. Now, obviously, after just one visit, we're not going to completely make this mouth normal, but we can be on the road to recovery and eventually get the teeth looking to stay level. And the important thing here is that we take as little as possible. We don't want to just go in and grind everything level. So keeping a careful eye on what's overlong and addressing that only, we can rehabilitate a mouth to come into a more even wear. So he's got a little bit of an overlong area on the front part of the third molar. And the overlong area on the caudal portion of the 7. And these are things we can address with hand floats to a satisfactory way. To address floating, when we talk about floating a horse, I get asked this question a lot. What is floating? What is the difference between floating and equilibration dentistry? Floating addresses the sharp points on a horse's cheek teeth. We don't typically think of addressing the incisors, the front teeth, when we're talking about floating. The teeth are at the chewing surfaces on the equine tend to be angled at about a 12 to 15 degree slant, okay? And they chew on one side at a time. Because of that circular rotation of the grinding, the teeth are self-sharpening. And what happens is on the maxillary or upper cheek teeth, the outside develops sharp points. We call that the buccal side, meaning cheek. The mandibular or lower cheek teeth on the lingual or tongue side develop sharp points as well because of the enamel in the horse's teeth. Their teeth are not coated in enamel like ours, rather they form in a vertical manner in ridges. So it's more like a washboard effect. And what happens is the points get very sharp and can cut into the tongue and can cut into the cheek when the horse chews. So when we talk about floating, typically we're addressing those sharp points with a 3-inch blade on a handle and file it front to back. Now, the floating portion is aside from the occlusal or the chewing surfaces, but areas can still be missed on hand floating at the back of the mouth on the mandibular teeth in particular. What happens, the jaw has a curvature. Depending on the breed of horse, the jaw will have some type of curvature at the back. When we're trying to get back in the back of the mouth with a hand float, it becomes very difficult sometimes to address the sharp points on the inside of the bottom teeth. But that is typically all floating addresses. We have many other malocclusions that form that hand floats just don't take care of to a significant degree. We hear concerns all the time of motorized instruments, and yes, they can be dangerous, but they can also be very, very beneficial and very safe at the same time. And here we have a rostral hook. So while I'm in here with this, I go ahead and take care of the floating, or the initial floating, which we would normally do with a hand float. The inside will rise at a 12 to 15 degree slant. And abnormal chewing patterns can cause points to rise not on the inside but on the outside of the cheek teeth. So when we go in here for equilibration dentistry, we want to just hit the very light spots to ensure that the cheek grinds in a consistent pattern without those points on the outside hitting the maxillary teeth prematurely. Now this is a bit seat that we're putting on here. We don't want to get too aggressive with them. If we get into the chewing surface of the tooth too much, we can get into the anterior pulp horn, the very front pulp horn, and you see a dark spot right back here. And I don't want to get that dark spot facing me. I want to keep it facing the roof of the mouth. And then I'll know I'm not going to cause damage to the front portion of that tooth. This type of dentistry has two major benefits. Obviously, the health of the mouth. We want to preserve the teeth for a lifetime and avoid molar extractions. But the other benefit to an equilibrated mouth is no inhibition of physical performance. So after targeting the areas that we needed to, we'll take a reciprocating float. Again, this is not for reduction. This is simply for finishing the polish on the equilibration and ensuring that we don't have an overlong or like a millimeter too long of a premature strike somewhere.